Imagine being desperate to protect yourself and your loved ones from COVID-19, but being denied the vaccine. This is the harsh reality for many Americans who are struggling to get vaccinated due to new restrictions imposed by the Food and Drug Administration. The FDA has limited the approval of COVID vaccines to only those who are at greatest risk of getting seriously ill, leaving many people feeling frustrated and angry. But here's where it gets controversial. While the FDA claims that most healthy younger people have enough immunity and don't need annual boosters, many independent medical organizations argue that everyone should have the option to get vaccinated. And this is the part most people miss. The new rules are not only affecting individuals, but also putting vulnerable family members, such as children and the elderly, at risk. For instance, Jason Mitton, a 55-year-old man with high blood pressure and high cholesterol, was refused the vaccine by pharmacists at a drugstore near his home in Austin, Texas. He was told that he didn't qualify according to FDA standards, and the pharmacy's policy was not to administer the vaccine unless the person qualified. Mitton plans to keep trying to get vaccinated, saying, "I think it's ridiculous. I think it should be a person's right to get the vaccine or not." Similarly, Cheryl Huge, a 64-year-old woman from outside Cleveland, was planning to get another shot as soon as the updated versions became available, but was told she's not eligible. She's furious, saying, "Who wants to get sick?" The same goes for many other Americans who don't meet the new criteria, but still want to get vaccinated to avoid getting sick or spreading the virus to vulnerable family members. The Infectious Disease Society of America argues that everyone should have the option to get vaccinated because there is convincing evidence that the vaccines reduce the risk of serious complications, including hospitalization and death, even for people who are otherwise healthy. But many people are having trouble getting vaccinated due to the new rules. Some are being turned away because supplies of the reformulated shots haven't arrived yet, while others are being told they need a doctor's prescription or must self-attest that they're eligible. The situation is further complicated by the fact that some clinics and pharmacies haven't received the supplies they've ordered yet, and some doctors' offices may decide not to stock the shots this year if they don't expect enough demand. The companies that make the shots, Moderna, Pfizer, and Novavax, haven't disclosed exactly how many doses they're making this year, given the narrower FDA approvals. However, Pfizer says it's preparing similar volumes as last year and is confident it will meet demand. Claire Hannon, the executive director of the Association of Immunization Managers, says she doesn't expect vaccine supply to be a problem, but notes that it may be harder to access. "I think it's going to be harder to access," she says. "But I think anybody that wants it, will be able to get it. But they're just going to have to work hard to find it." The Centers for Disease Control and Prevention is also playing a crucial role in the vaccination process. However, the agency's recommendations for who should get vaccinated have been delayed, and it's unclear what the new guidelines will be. The CDC's Advisory Committee on Immunization Practices, which formulates those recommendations, was fired by Health and Human Services Secretary Robert F. Kennedy Jr. and replaced with new members who share his views. This has led to confusion and hesitancy among pharmacists and doctors who are unsure about what to do. Until the committee meeting happens, the shots that are part of the Vaccines for Children program won't ship, says Hannon. About half of kids in the U.S. are eligible for free vaccines through the program. Health insurance coverage could also prove tricky, with some insurance companies covering the COVID shot with no cost sharing, while others may not. The situation is particularly concerning for vulnerable family members, such as children and the elderly. Allison Coate, a 32-year-old mother from Bristol, Connon, wants to stay well to protect her father, who has heart failure, and her 16-month-old son, who is not eligible to get vaccinated. It's just really upsetting, she says. Why do I have to jump through hoops to do this? It's kind of scary. Stefan Neidenbach, a 45-year-old public school teacher from Annapolis, Minnesota, is frustrated and angry about the situation. He's worried about getting sick and spreading the virus to his students, his elderly parents, or his mother-in-law, who has lung problems. I would feel horrible if I did get it, and if I passed it off to someone that I cared about, he says. It's terrifying. Therese McRae, a 37-year-old mother from Sandy, Utah, wants to get vaccinated to protect her 4-year-old daughter, who has type 1 diabetes. Being a parent of a young child with a complex medical diagnosis is hard enough, she says. Having folks around her not being able to be vaccinated increases her risk. It's just very overwhelming. It's scary. Karen Lambie, a 43-year-old woman from near Richmond, Virginia, desperately wants a vaccine after developing long COVID. She's afraid of spreading the virus to her immunocompromised parents. That could potentially be life-threatening for them, she says. I couldn't live with that. As the situation continues to unfold, one thing is clear. The new restrictions on COVID vaccines are causing frustration, anger, and fear among many Americans. But here's the question. Should everyone have the option to get vaccinated, regardless of their age or health status? Should the government prioritize the health and well-being of its citizens, or should it prioritize other factors, such as cost and logistics? The answer to these questions is not simple. And it's likely to spark a heated debate, so we want to hear from you. What do you think about the new restrictions on COVID vaccines? Do you think everyone should have the option to get vaccinated? Or do you think the government is making the right decision? Let us know in the comments.